This is Jay Dela Cruz, first year nursing student, and I'll be administering oral medications for this video. So, medications are usually given orally since it is the most comfortable and most convenient route of administration. So, the first thing that we need to do is to check for the physician's order for what drug should be given to the patient, and also check for the MAR or the medication administration record to check for the drug name, the dosage, how frequent, and the route of drug administration. Also, check for the patient's ability to take medications orally since some patients might have difficulties in swallowing or dysphagia. Now, I'm going to organize my supplies starting from my medicine tray. Next is my medicine cup and medicine dropper. And also another medicine cups. My stethoscope for taking vital signs later, and my sphygmomanometer. Since I will be handling medications, I will first wash my hands before meeting the client. Now that we're done washing our hands, let's take the appropriate medicine that is written on our MAR. First, let's check our label if it's correct, while noting also for the expiration date. And compare the label from the medicine and also from our MAR. Lastly, recheck the label to make sure that it is correct. Now let's prepare the prescribed medications. Now for tablets or capsules, gently shake the prescribed amount on the bottle cap. And since the medicine is outside the bottle, it is already unsterile and therefore we cannot return the medicine back to the bottle. So we have to take a medicine cup and put the medicine on that and place it on our medicine tray. For liquids and suspensions, take the medicine and thoroughly mix the medication. Now remove the bottle cap and place it on the countertop upside down to prevent contamination. Then hold the bottle so that the label is facing your palm and pour the medicine away from the label. This is to prevent soiling the label and making it unreadable. Now take your medicine cup and adjust your height at the surface at eye level area. Now, place your thumb at the prescribed level of medication and pour the medication, noting for the lower meniscus. Now wipe the rim of the bottle with a paper towel. This is to prevent the medicine from sticking the bottle cap. Then place the medicine cup with the medicine on our medicine tray. So for the dropper, we use the medicine dropper when the prescribed amount is less than 5 milliliters. So take the bottle and then draw up the prescribed amount, which is 1 milliliters for this case. Take our medicine cup and place our medicine dropper on the medicine cup. And place the medicine cup with our dropper on our medicine tray. And wipe off the bottle rim. And close and place it on the shelf. Afterwards, take our prepared medication and place it together with our MAR on the same medication cart so it won't get lost. Then check the room number against the MAR before entering the client's room. This is to ensure that we are entering the correct room. And also, let's provide comfort and privacy for our patient. So good day, my name is Carl and I'll be your student nurse for today. So I'll be administering your medications. So before that, may I ask for your full name?
Yes, Jay Dela Cruz.
Okay, so when is your birthday?
December 9, 2023.
So how old are you?
28.
Okay, so how do you want me to call you?
Cindy.
Okay, so do you have any allergies from food or drugs so that we can avoid them?
No.
Okay. Alright, so I'll just match up the medications and the MAR. Okay, so this time I'll be taking your vital signs to detect delayed recovery or adverse effects of the medicines. Okay. Okay, so first I'll be taking your temperature. I'll just grab this thermometer and tune it. Okay, so can you lift your arm? I'll place it under your armpit. Okay. Alright, so this time I'll be taking your blood pressure while waiting for the thermometer to go off. Okay, so your blood pressure is 120/80. Okay, you just grab the thermometer. Okay, so your temperature is 36.5. Okay, so do you have any questions about your medications?
No.
Okay, so I will still be discussing to you the purposes of the medication so that you will be aware of them, alright? So your physician prescribed you with Zithromax, also known as azithromycin as its generic name, with a dosage of 500 milligrams to be taken once a day for 3 days. So Zithromax is an antibiotic that helps to fight the bacteria that cause your pneumonia. So it helps to stop the growth of the bacteria. So side effects may cause nausea, diarrhea, stomach ache, and vomiting, alright? So since it is in a tablet form, you will be taking it orally, alright? Okay, so your physician also prescribed you with Sanmol, also known as paracetamol, as its generic name, with a dosage of 5 ml to be taken twice a day for 2 days. So it helps relieve fever by blocking some certain chemical messengers that is responsible for fever and pain. So side effects are rare for this medication, but you may feel nausea or headache while taking this, alright? So since it is in syrup form, you will be taking it orally. Alright, so for your last medication, you have your guaifenesin with a dosage of 1 ml to be taken every 4 hours for 3 days. So guaifenesin will help you treat your cough and congestion that is caused by your pneumonia. The side effects may cause nausea, headaches, or stomach ache. So since the prescription is only 1 ml and it is less than 5 ml, you will be using a dropper to administer the medication orally, right? Okay, so do you have any concerns or clarification with your medications? Okay. Okay, so I am going to assist you in a sitting position to facilitate swallowing and prevent aspiration while taking the medicine. Okay, so Ms. Cindy, are you ready to take your medications now? Okay, so for your first medicine, you have your Zithromax. Okay, so drink this water to ease the swallowing. Okay. Alright, so for your next is your Sanmol or your paracetamol. Right. Right, so for your last medicine, we have your guaifenesin in a dropper. Okay. Take your water. Right. Alright, so Ms. Cindy, you have been a wonderful patient. So now that you've taken all your medications, I'm gonna leave you now and I'm gonna give you this remote if you need me, and just call me by pushing this button, right? I'll put this here. And I'll leave you now so that you can take a rest. And I'll see you next time, alright? So afterwards, make sure to document each medication given, the dosage, the time, any complaints or assessment of the patient, and also your signature. If medication was refused or omitted, make sure to document this fact on the appropriate report. And also document the reason if possible also. Right, so in my case, I have given 3 medication. First is the Zithromax, which is for 500 milligram dosage. Next is the Sanmol or the paracetamol for 5 ml. And lastly, for the dropper, 1 ml, it's the guaifenesin. Right, so all 3 medications were administered on the same day, April 27, 2022. I'll also record the time, which is 3 p.m. Afterwards, make sure to replenish the stocks that we've used, such as medication cups, and return the medication cart at its place. And proceed to the aftercare of the equipment by washing with soap, rinsing with water, and drying it. And that's it for administering oral medications.